Hello friends, and welcome to the channel once again. I'm Dr. Mohsen Raj Mantu. I've done my MBBS from GMC Srinagar. I then did my MD from AIMS New Delhi, and now I'm a DM cardiology student at AIMS New Delhi. The title of this video is Stress in the MBBS College, how it arises in the first place, and how or what you can do to mitigate it, what you can do to solve these issues, and how we can actually rise above various stressors. So, like many of you, even I was told that once you join MBBS, life will be like the left side of this picture. You'll be, you know, things will be a lot easier than your class 11th, class 12th. Work hard in 11th and 12th, and then your life will be beautiful in an MBBS college, or as a doctor. But then most of you, within months of joining medical school, will feel like this. You're totally, overburdened by the amount of work that is required from you, and by the amount of information that you have to read, or the standard of the books that you have to read, or the material that you have to deal with. And somehow these things have given rise to various mental disorders in medical students. This is a study from JAMA, one of the most reputed medical journals. And in this meta-analysis, they found that about one third, about 27% of medical students have some sort of depressive symptoms. And in fact, 11% have suicidal ideation. And what was interesting to note is that a handful of these patients, a handful of these medical students, just 15% actually seek medical treatment. They are in the medical school, they have these symptoms, and just 15% actually seek treatment for their symptoms. So, but there are studies that have shown in a scientific way that what are the key reasons of stress in medical students. Number one is academic performance. Number second is the pressure that you have to succeed. And third, the post-graduation plans. See, we understand that our academic demands, the requirements, these subjects are huge, enormous. These are professional subjects, 19 different subjects clubbed together, and they form a degree called MBBS. Each subject is a specialty in itself. Each subject, there can be 4 or 5 big books on one subject. So that is a big burden on us. And on top of that, you're expected to appear in those terminal exams, then pre-prof exams, and professional exams. You have an exam almost every 4 months, or maybe every 6 months in MBBS school, in MBBS college. And we know the environment on the day of the exams. Initially you might be like, say, at the start of your professional, at the start of your say maybe first year or second year, you'll be looking for all different books. Okay, I'm going to read this author book. I'm going to read an additional book by this author. But then over time, things, and just prior to the exam, even I recall my final year MBBS days, just before my final prof, I was not in a good state. I was also nearly depressed. Obviously, I knew that I'm going to overcome it, but everyone, not just you, every single medical student prior to professional exams will feel stressed up, will feel overworked and overburdened. Simply, not that he is underperforming, but because the task is too big. See, in your final prof, for example, you'll be, you're supposed to appear in medicine, surgery, obstetrics, and pediatrics. These subjects are big specialties. You're supposed to master all these subjects in a matter of 1 year, and then appear for an exam. And then there'll be a professor who'll ask so many questions to you and expect too much from a young medical student. The environment, that time is stressful, but somehow we do overcome it. The second thing that's responsible for the stress, besides the enormous material that you have to read, these so many books, is sometimes, in almost every college, you will have a few departments which are toxic. Maybe somewhere the preclinical subjects are little toxic, somewhere clinical subjects are toxic. You do have somewhere a professor who is like this, waiting for students, who is torturing students day in and day out. Even I recall my MBBS days. One of our, in fact, the head of the department of surgery at that time, general surgery. So he was like, he would fail anyone in the final prof exam. And my friend, a very close friend of mine, who was as good as me, who we used to read together, who was, as thorough with studies as with me, And in the final year exam of surgery, he failed that student. In fact, his theory marks were very good, but he failed him simply because he feels like he's the don of that place and kind of, such toxic people are everywhere. In some departments in every medical college have such toxic minds. And that person, that friend of mine, suffered. He had a 6 month break, he joined internship late, he missed his NEET PG, but eventually, of course, he's a good student. He proved his point. He then got a very good rank in NEET PG. He did his MD in radio diagnosis. He's a very good student. He's a good, he's happy with his life now. But that point, that was very stressful seeing him, in that situation when I know he's a good student. Everyone knows he's a good student. But because of one faculty member, he was failed. And that made him, very depressed at that point of time. The third source is the competition that's there in the medical profession. See, once you join a medical college, see, maybe after the second year of MBBS, you start thinking, okay, now there's a post-graduation exam. And then once you're doing post-graduation, you think, now there's a super specialty exam. So there are so many needs, NEET UG, NEET PG, NEET SS. Things will not stop. So this competitive environment in a medical college is another reason why people get stressed. And interestingly, this was one of the common reasons of why medical students have depression, their plans for post-graduation. And last but not the least, most of us who join medical school are little type A personalities. We want to be perfect. We don't want to commit mistakes. We want to be the best in the class. Well, that's okay to some extent, but that at times, adds to the burden that's already there in each and every student, each and every medical student. But someone who is more type A plus personality, he will suffer a little more. Now, once I've highlighted the most important sources of stress, I told you the professional nature of our books, so many subjects, so many exams. That's one reason. The second reason being that sometimes some departments, some professors are toxic. They do trouble innocent students. They do sometimes fail a bright student. Third, the fact that the environment in these medical colleges is very competitive. The demand of this profession is that you become more and more skilled. See, you stand nowhere after MBBS. No student after MBBS can safely and competitive and actually competently treat patients. It needs higher education. Even for that matter, an MD medicine or MD pediatrics resident will not be full-fledged doctor. He needs senior residency to practice his skills. So this profession demands a lot of these degrees. You need to do a MD. You need to do a senior residency for you to become a good person, a good doctor. So that is the stress part of it. What leads to stress? But how can we avoid this stress? The number one formula is you have to avoid burnout. See, be it on a daily basis or weekly basis or monthly basis, you have to take breaks. Every day when you read, maybe you've read for 2 hours, take a break, take a half an hour break, spend time with your family, spend time with your parents, play some game, whatever you want to do, but take a break. That gives two benefits. One, you're away from this so-called stressful task of books. You're away from it. That lets your brain assimilate that information, and at the same time you're doing something else. Maybe you're listening to music, maybe you're playing some computer game, maybe you're playing some outdoor game. So that actually de-stresses you in that way. So avoid burnout, take breaks every day, take breaks every week, and take a total off day a week. At least give one full day of total free, which is a day which is just meant for you. No professional work, no studies. There has to be a day in a week. There has to be an hour at a minimum every day where you're just you and only you. You're not worried about books. You're not worried about anything else. So avoid burnout. Second, be physically fit. No matter, you may be a type A personality. You want to be the number one person in the class. You want to top, you want to get an all India rank one. That's possible only if you're physically fit. So focus on your physical fitness. Physical workout that has to be in your daily schedule. When you're planning out your day, you have to keep a 30-minute or maybe 1 hour of physical. That could be like outdoor games again. You may go to gym, you may play badminton, whatever you want. You may do cycling, whatever you want to do. But that is an important strategy to de-stress yourself. Third, which I believe is very important, is that you have to contact your seniors. If you're stuck in your MBBS, if you're stuck somewhere in some subject, or whatever, even non-academic things, if you're stuck, there are seniors around you. See, there will be a senior who has been in an exact same situation as you, right, at that point of time. So you can consult him and he is going to definitely guide you. See, I have myself had help, I've received help from so many of my seniors at places where I thought, okay, I cannot move beyond the situation. I cannot understand this thing. I may not be able to finish this task. But then you take help of seniors, and in fact, I said that there are some toxic faculties, but I tell you that there will always be at least one faculty in every single department who is student friendly, whom you can easily approach, go to his office, talk to him, discuss your problems. I tell you, you will get help once you seek it. Now, fourth, the last one in this video, otherwise it's going to be lengthy. Remember, see, you may maybe whatever year you're studying in MBBS, final year or third year or first year, sometimes you feel that it's too much of a task. I have 4 big books to complete. But let me tell you, don't look at it as a task or whatever. If you may be a resident, you may be doing MD in medicine, you're working tirelessly in what, 24 hours, 36 hours on it. Don't look at it as a work. I was on 24, 26 hours, in fact, non-stop duty, seeing all cardiac emergencies that came to AIMS emergency the last 24 hours. I did not look at it as a job to me. I looked at it an opportunity where I can express my skills. I might have read something in the book maybe 2 days back. I see a new patient, I apply those concepts to the patient, I see signs every day. That's the beauty of medicine. See, this is not physics. This is not quantum mechanics where you have to imagine things. No, you read things, you think of these, concepts, and then you see them every day in patients. So that way, your job is not a job. Your job is not a task. It is the art that you're creating. It's the art that you're witnessing. Medicine is not just science, it's an art. This is your Sistine Chapel. You know, Michelangelo painted Sistine Chapel. Whenever you treat patients, whenever you read your books and explain concepts to maybe younger students or maybe use those concepts to treat patients, that is your Sistine Chapel. So don't look at it as your work. Look at it as an art, as a craft that you're designing. This is your life. This is your Sistine Chapel. So with these words, let's end this video. I wish you luck for your MBBS journey and beyond. And if you like the content, do like this video, share and subscribe the channel. Thank you.